갑자기 내게 나타나준 너, 난 아무 말도 할 수가 없었지. 첫눈에 반한다는 이야기가 널 보는 순간 이해가 됐어.
Hello guys, hello everyone. Magandang araw po sa inyong lahat. Today I'm here in the garden. It's a nice view and it's fresh air. Today guys, we are gonna talk about the different types of headaches, their symptoms, signs, and their treatment. We all know that headache is the most common form of pain. Some people have them if they don't get enough sleep, if they don't have enough water, or if they are tired. And there are common types of headaches, and all of them indicate something about your body. But if you learn the signals, you will know how to learn to treat them properly. Also, sometimes headaches is a sign that something is wrong. Well, continue watch on to this video and you will learn the signs and symptoms that will help you learn not to worry or when to worry about headache and how to treat them well. Well, let's watch this. So these are the types of headaches you should know. Number 1 is sinus headaches. As it is implies, a sinus headache occurs when sinuses become inflamed or blocked. This can cause pain behind the cheeks, nose, eyes, that gets worse when you bend forward or when you wake up. Consume as many liquids as possible. You possibly will be benefits a lot from the use of warm water since it effectively reduces the inflammation and opens the sinuses. Also, you can try apply cold or hot compress. Number 2, tension headaches. It is the most usual headache type. It can last between a few minutes to a few days. Triggers includes lack of sleep, missed meals, stressful situation, high emotions, and alcohol. You may feel dull, aching sensation all over your head. It is throbbing, tenderness, or sensitivity around your neck, forehead, scalp, or shoulder muscles. It is triggered by stress. The treatment: massage your head a few minutes and combine peppermint oil and green tea in order to successfully reduce the pain, and add some peppermint to the hairline to cause a cooling sensation with the intention to relax the head and neck muscles. A warm shower may also help. Hot compress on the neck and back of your head. 3. Cluster headaches. Cluster headaches characterized by a severe burning and piercing pain. They occur beyond or around one eye or one side of the face at a time. Sometimes swelling, redness, flushing, and sweating may occur. Nasal congestion and eye tearing also often occur on the same side of the head. It lasts for 15 minutes and it is mostly affect women. The treatment is the capsaicin cream. Includes an active ingredients. Number 4 types of headaches is migraine headache. Migraine as usually occur between the age of 25 to 55, but they can also be experienced regardless of the age. This headache type is way more complicated than any other headaches because it includes numerous different neurological symptoms. Migraine is an intense pulsating from deep within your head. This pain lasts for a few days. It is throbbing and as usually one-sided. People with migraines are usually sensitive to light and sounds. Nausea and vomiting also occur. Some migraine also preceded with visual disturbances. Most women are affected on it. The treatment: it has been shown that many migraine patients benefit from the use of omega-3 fatty acids. From the use of omega-3 fatty acids or vitamin B12 or riboflavin and magnesium Involve sufficient amount of them in your diet in order to prevent migraine, or place a cold pack on your forehead for 15 minutes with ice cubes. Rubs with towel or even cold shower may ease the pain. So the number 5 type of headache is hypertension headache. High blood pressure can also cause you to have headache, and this kind of headaches signals an emergency. This occurs when your blood pressure becomes dangerously high. A hypertension headache will as usually occur on both sides of your head and is typically worse with any activity. It has a pulsating quality, and you may also experience changes in visions, numbness or tingling sensation, nosebleeds, chest pain, or shortness of breath. If you think you are experiencing a hypertension headache, you should seek medical attention. You may likely to develop this type of headache if you are treating high blood pressure. This type of headache as usually go away soon after the blood pressure is under control. Number 6 type is rebound headache, also known as medication or overuse headache. Can feel like a dull tension type headache, or they may feel more intensely painful like migraine. You may be more susceptible to this kind of headache if you frequently use over-the-counter pain reliever. Overuse of these medications lead to more headaches rather than fewer. So stop and avoid using too much over-the-counter medication as a pain reliever. Number 7 is post-traumatic headache. Post-traumatic can develop after the type of head injury. This headache feels like migraine or tension type headaches and as usually last up to 6 to 12 months after your injury occur. When to see a doctor? In most cases, episodic headache will go away within 48 hours. If you have headache that lasts more than 2 days or that increase intensity, you should consult a doctor. And if you're getting headaches more than 15 days out of the month over a period of 3 months, you might have chronic headache conditions. Number 8 is hormones headache. Women as usually experience this kind of headaches that are linked to hormonal fluctuations, menstruation, birth control pills, and pregnancy, and affect your estrogen levels, which can cause headache. These headaches associated especially with the menstrual cycle and are also known as menstrual migraine. This occurs might before, during, after menses, as well as during ovulation. So the treatment for these hormone headaches are relaxation techniques like yoga exercise, acupuncture, and eat a modified diet may help prevent migraine headache. To avoid too much migraine headache, we have to do some yoga exercise sometimes. Number 9 is caffeine headache. Caffeine headache affects blood flow to your brain. Having too much caffeine can give you headache. People who have frequent migraine are at risk of triggering a headache due to their caffeine use. This may be because caffeine changes your brain chemistry, and withdrawal from it can trigger a headache. Number 10, exertion headache. Exertion headaches happens quickly after periods of intense physical activity. Weightlifting, running, and sexual intercourse are all common types of an exertion headaches. It is thought that this increased blood flow to your skull, which can lead to a throbbing headache on both sides of your head.
Now, let's go to a forehead pain. I hope that your head will not be paining you because the topic now is about headache. Sana'y wag din sasakit ang ulo nyo sa kanonood dahil lahat ng aking video ngayon ay it's all about headache. And now, let's find out about the forehead pain. Dito po is our forehead pain, their signs, causes, and treatment. Forehead pain can be distracting, painful, and uncomfortable. It can also make your day difficult and it's very hard to focus. In this article, we will explore the different types of forehead pain, why they happen, and what might be done to treat them when they occur. Grabe, puro headache ang topic ngayon, pati ulo ko yata sasakit. Ang hirap ko naman po mag-English. Pasensya na po kayo sa bulol kong English. Now, let's go to the different types of forehead.
The type of forehead pain you experiencing can tell you a lot about what's happening inside your head. These are the most common types of forehead pain. Number 1, throbbing pain. A deep throbbing forehead pain may feel like its pulsation comes in waves. It often seems weighty and feels like it's putting a great deal of pressure direct onto your forehead. It may be persistent and last for an hours if you don't treat it. This type of forehead pain may be caused by migraine, a hangover, tension, or other issues. Number 2, piercing pain. A sharp pain. Stabs of piercing pain can occur. These are often short in duration but intense in severity. Brain freeze, that painful sensation that occurs when you eat or drink something cold, is as common cause as is a cluster headache. More serious issues like an aneurysm are also possible, however, these are rare. Shooting pain. Similar to throbbing pain, feels continuous but it may seem like trails or pain are shooting away from your forehead. This type of pain is common with conditions like hypertension and infections. Other symptoms that may accompany forehead pain, you may experience other symptoms. This can give clues as to what you're experiencing. For example, you have forehead pain and feeling weak and lethargy. You may be experiencing low blood sugar. The following symptoms can occur with forehead pain: nasal congestion, fever and chills, nasal discharge, nausea, diarrhea, feeling weak or shaky, feeling lethargic, intense pressure in your ears, irritation or agitation, pain in the neck, jaw, or scalp, and eye pain. When you begin feeling forehead pain, consider any other symptoms or changes you may be experiencing these. This can also figure out the possible causes of your forehead pain. These are the serious symptoms that may indicate the threatening conditions.